Hello friends, welcome to a new episode of Drishti IAS Editorial Analysis. In this editorial analysis, we do three things. First of all, we link the editorial to the UPSC syllabus. Secondly, we try to understand the key points of the editorial. And thirdly, we also look at the key concepts that have come in the editorial and are important from exam point of view. Now let us begin today's editorial analysis. Today's editorial has been taken from the Hindu and it has come on 11th of May. The title of the editorial is Coming to Terms and it talks about the virus containment measures taken by central and state government, and it says now the governments must assume that community spread is taking place, that is community transmission is taking place, and take adequate measures. Now let us look at the linkage with UPSC syllabus. So it links directly with GS paper 2 where we have issues relating to development and management of social sector services relating to health, and it also links with GS paper 3 where we have disaster management because it is dealing with COVID-19 pandemic and the community transmission of that. So it comes under disaster and disaster management as well. Now let us look at the key points of the editorial. The editorial makes a point that central and state governments must now enforce virus containment measures assuming community spread. For a long time, the Indian government has denied community transmission of COVID-19, and with the cases approaching 63,000, the government must now assume that some community transmission is definitely taking place and take proper measures to control it. The editorial says that even on March 28, the Health Ministry had acknowledged that there was limited community transmission, and now we are sitting on May 11th and still the government is saying that no community transmission is taking place. So something seems to be amiss. And on April 9th, the ICMR, the Indian Council of Medical Research, and Health Ministry researchers in a journal, they had provided evidence suggesting the prevalence of community transmission in 36 districts across 15 states. And even in a sentinel surveillance for community transmission undertaken among the patients hospitalized for severe acute respiratory infection, it was found that 40 of the 102 who tested positive for the virus had no travel history or contact with a known positive case. And for 59 patients, the data on exposure was not available. So here also, like 40 out of 102 was a very significant number. And here we should also know about sentinel surveillance. So sentinel surveillance is used when high quality data for a disease is needed and it cannot be obtained through a passive system. In such case, sentinel surveillance system is used. Even after this kind of data was reported, yet the Indian Council of Medical Research has consistently maintained that the virus had not spread to the community. Now we'll see about ICMR and also about community transmission in detail in key concept section. But for now, we should know what is the difference between local transmission and community transmission. So if A is infected and we know for sure that B has infected A, in that case, it is a case of local transmission. And when A is infected, but we do not know exactly who has infected A, then we say someone in the community must have infected A. And in this case, we say that it is a case of community transmission. On May 5, even when the total number of nationwide cases was close to 47,000, the health minister said that India's virus spread had not gone to stage 3, which is the stage of community transmission. So the Indian government has been consistently saying that community transmission has not taken place. Though for a disease like COVID-19, which spreads so easily, it is very difficult and very hard to understand that how come community transmission is not happening and when we have such high numbers. Further, the editorial talks about hesitation in declaring the community transmission. It says that while there has been no hesitation in declaring local transmission caused by people who have a travel history, the government has been extremely hesitant to admit community transmission. And this reluctance is surprising given that the total cases reported so far has exceeded 63,000. And the nature of spread is through droplet transmission and contact with contaminated surfaces, makes this disease that much more contagious and very easy to spread. And it also cites the example of US, which on February 26, when the total number of cases was just 60, it confirmed community spread following the detection in California of the first case with no travel history or contact with a known positive case. So this shows the contrast between the approach of US and approach of India. Though there is a lot of difference in where India is and where US is in terms of the numbers and especially in terms of fatalities. But the thing to note here is that based on only one positive case where they realized that there was no contact history, they immediately accepted that there has been community transmission. But in India, there has been sufficient evidence and it has been acknowledged by various government agencies. But the government has still been denying that there is any community transmission. The editorial further talks about the probable reason for India not accepting community transmission taking place early on could have been the compulsion to expand testing when the country did not have the capacity to test huge numbers each day. And right now, India is testing around 95,000 people every day, and almost 15 lakh tests have been done so far. But these numbers took time to scale up, and even now, India needs more testing in terms of the population size that we have. So, one thing was this lack of availability of tests early on, and the fact that these tests had to be imported from other countries. But now, with the Indian pharmaceutical companies coming up with tests, the government should not have a problem to scale up testing. So, editorial makes the point that there is no reason now to continue being in denial, as it erodes public trust, and public trust is paramount in defeating an enemy like COVID-19, because for so many things it is only the voluntary action taken on the part of the citizen that can help in preventing the spread of this disease, and the government cannot enforce all the rules without citizen cooperation. The National Institute of Virology, Pune, has come up with an ELISA test for COVID-19, and this test, because it is indigenous and it is much more reliable than the rapid antibody tests that were imported from China, so now Indian government will be in a position to rapidly scale up the testing so that COVID-19 can be contained. We'll also look about this ELISA test in the key concept section. Now the Indian government is planning a study in 75 hotspot districts to confirm this community transmission and also to ascertain the proportion of community already exposed to the virus. And because there was high unreliability associated with the rapid antibody tests, the government will now use the ELISA test to check for infection. So ELISA test stands for Enzyme Linked Immunosorbent Assay Test, and it detects antibodies to the virus. So whenever any infection attacks the body, then you have antigens, which are the harmful substances, and you have the antibodies, which are basically proteins formed by the body to respond to these antigens and to defeat them. So the ELISA test, it detects the presence of these antibodies, and it is much more reliable than the rapid antibody tests. And through this survey in 75 hotspot districts, the government will be able to identify previously infected people, including those who remain asymptomatic during the entire infection. Because here we have to know that out of the 100% people who will get infected with this COVID-19, 80% of the people will not show much symptom. It will hardly affect them. And only 20% are seriously affected. Out of those, 5% need ventilator support and the other 15% need hospitalization. But when we consider the case of India, in absolute numbers, these percentage figures become very huge. Further, it takes 1 to 3 weeks for the antibodies to develop. So the ELISA test will miss recently infected people. So the people who have got infected very recently and the antibodies have not developed in their bodies, the ELISA test will not be able to identify those individuals. And the number of people going to be tested under this is around 30,000 people. So it will give a very clear-cut indication that community transmission is taking place or not, though the overwhelming evidence is that community transmission is already taking place in some form or the other. Finally, the editorial says that meanwhile, all the states should continue with strict containment and mitigation measures, acting on the assumption that the virus has indeed spread in the community. Here we should understand that communicating clearly is a core part of the public health, because public health is not just about building surveillance system and infrastructure, but also about enabling people to change their behavior in the right ways. Now in the COVID-19 pandemic, a lot depends on how responsible the Indian citizens are in practicing containment strategies, which will involve social distancing, which will involve frequent hand washing, which will involve quarantining when you feel that you might be infected and you can infect others, and also reporting to designated authorities whenever you feel that your symptoms are getting serious, and as per the protocols you report to the designated hospitals. And also it is about wearing face mask and taking all adequate prevention. So all these things are possible only when the citizens trust the government, and for trusting the government, clarity in communication plus transparency in communication is highly needed. So the government has to make sure that the communication is very clear and transparent with the citizens as far as containment strategy is concerned. So this was all in the key points. Now let us look at the key concepts. So let us first of all look at Indian Council of Medical Research, also known as ICMR, So it is the apex body in India for the formulation, coordination and promotion of biomedical research. Now what is its mandate? To conduct, coordinate and implement medical research for the benefit of the society and translating medical innovations into products, processes and introducing them into the public health system. Now it is funded by the Government of India through the Department of Health Research under the Ministry of Health and Family Welfare, and it is one of the oldest and largest medical research bodies in the world. And the present Director General of ICMR is Sri Balram Bhargav. Now let us look at the 4 stages of transmission of diseases. Now the first stage is imported transmission, when the disease is imported from another country. And here we should know that any disease for that matter will always have a country of origin. For example, in 2009, H1N1 influenza, it started from Mexico. And here in 2019-20, we have the COVID-19, which has originated from China. So the first stage is of imported transmission. So it is reported among the travelers entering the country via the borders and airports. And these can be controlled through thermal screening and quarantine. Now the second stage is of local transmission, and WHO defines it as the transmission through direct contact with an infected person within the country. So within country, if A is getting infected by B, then we have this case of local transmission. And stage 3 or the third stage is of community transmission, and it signifies that a virus is circulating in the community and can affect people with no history of travel to affected areas or of contact with an infected person. So when A is getting infected, but the source from which he or she is getting infected is unknown, then it becomes a case of community transmission. India's current emphasis on social distancing and discouragement of public gatherings is aimed at checking community transmission only. Because once community transmission begins, it will be more difficult to trace contacts, as one unknown source of infection can infect many people unknowingly. And the fourth stage is stage of epidemic, which is a large outbreak, one that spreads among a population or region, and it is less severe than a pandemic due to a limited area of spread. And here one more important thing to note is that when any epidemic advances, community transmission is inevitable and unavoidable. So sooner or later community transmission will take place if the disease is not contained. Now let us look at ELISA. What is ELISA test? So ELISA test stands for enzyme linked immunosorbent assay, and here assay means investigation. So it is basically a serological test. A serological test basically means a blood test to check the presence of a particular antigen or antibody. So ELISA checks for antibodies, and ELISA is an immunological assay, an analytical procedure commonly used to measure antibodies, antigens, proteins and glycoproteins in biological samples. Now some examples include diagnosis of HIV infection, where ELISA test has been a game changer, pregnancy test and various other diseases where ELISA is used. And here we should know the difference between ELISA test versus the rapid antibody tests, which were mainly imported from China, but they were discarded because they were very unreliable. But these rapid antibody tests, they have an advantage that they are easy to use, they require very simple settings, and they are quick and easy to perform, 10 minutes to 2 hours. That is why they are called rapid antibody tests. But on the other hand, the ELISA tests, they are highly sensitive and specific tests, but they require some sophisticated equipment, and they are not suitable for small labs but for testing large number of samples. So if you have to test large number of samples, then ELISA tests are more handy. And here we should also know about the RTPCR tests, which are the most famous tests as far as COVID-19 is concerned, and the most reliable also. So RT-PCR stands for reverse transcription polymerase chain reaction, and it detects the RNA of the coronavirus and it enables detection of current infection. So here it is different from ELISA, because ELISA detects antibodies and they will be present in case of a past infection. For a current infection, RT-PCR is better, but RT-PCR has a downside that it cannot detect past infection because the virus will not be present in the body. Let us now look at the questions that can be asked in PT and mains related to this editorial. So in PT, one can be asked about community transmission, which stage of the disease transmission is this, how it spreads and so on, and what are the other stages. Also one can be asked about ELISA, which institute in India has come up with the ELISA test for coronavirus for the very first time, and also about RT-PCR, how is it different from rapid antibody tests and so on, and whether RT-PCR tests RNA or for DNA. So it tests basically for RNA. So these kind of questions can be asked in prelims, which are more of factual nature. But in mains, one can be asked about public health challenges and public health opportunities that this crisis provides for a country like India, where the GDP that is spent on health is very low, around 1.2%. So, how it should be scaled up? So, a crisis like COVID 19 presents opportunity for the government to scale up the public health infrastructure and also start spending more money on public health facilities. So, here we should be ready with what kind of steps can be taken by the government to deal with such a pandemic in future as well. So these are the kind of questions that can be asked. So this was all in today's editorial analysis. See you next time with another editorial. Thank you.